Welcome to Sounding Board, a community access television production of Soroptimist International of Novato. Soroptimist is a global organization with membership in 120 countries, and its primary mission is to improve the lives of women and girls through social and economic empowerment. My name is Nancy Weber, and I'm the moderator for tonight's show, and we will be discussing HEAL, Healthy Eating and Active Living, and my two guests are Rebecca Smith and Pam Shinault. Rebecca is with the County of Marin Health and Human Services. She is the program manager for Marin County Nutrition Wellness and the Healthy Eating Active Living Initiative. With a background in social work, Rebecca has a long history of coordinating various health and social services programs for children and families. Pam is the Director of Parks, Rec, and Community Services for the City of Novato. She's been with the city since 1997, and during her tenure has been lucky enough to have participated in bringing lots of new active recreation facilities and parks to fruition. Novato has and continues to show a strong commitment to helping keep the community engaged and healthy through parks and recreation facilities and programs. Rebecca, do you want to tell us what HEALED is?
Sure. Well, the Healthy Eating Active Living Initiative is the County of Marin's first coordinated, collective approach to the obesity epidemic. And about 2 years ago, the Department of Health and Human Services brought together partners with the understanding that the obesity epidemic is something that's very complex. There's no single cause and there's no single organization that can overcome it. And we wanted to look at what's happening in Marin, what are our assets and our strengths of our community, what are the needs and gaps, and what are our priorities for improving health in our community. And we brought together probably 70 different stakeholders, from folks from local agriculture, from Parks and Rec, from schools and early childhood, transportation planners, kind of the whole gamut of community partners, and did just that, looked at our data and talked about what's happening in the communities and developed a strategic framework for moving forward. So HEAL is basically that strategic framework and the partners that are coming together to make those priorities a reality.
Right, and Pam, Novato is a partner in this program.
Yeah, the City of Novato is participating in the countywide HEAL initiative. We serve on the steering committee that helps coordinate the 3 different implementation teams that have been created so that the strategic framework, working with other community partners, there's action and there's things happening on the ground so that we are having an impact countywide. Now locally in Novato, we are considered a HEAL city because we joined the statewide HEAL Cities campaign, and that's a coordinated effort of the League of California Cities and the California Center for Public Health Advocacy. And the goal with that is enacting new policies to help address the obesity epidemic. And the obesity epidemic, Rebecca mentioned, is kind of a complex issue, and primarily it's due to inactivity and inadequate nutrition. And so you're going to see things coming in the future around food and beverage policies, so maybe healthy vending machine policies, reducing youth access to sugar-sweetened beverages, because what I find so amazing is 1 soda per day increases a child's likelihood of becoming overweight by 55%. And so that's pretty astounding. And that has triggered, over the last 30 years, a pretty significant increase in the weight of our nation. And so we joined the HEAL Cities campaign so that we could really focus on a number of key areas. There's 3 areas that we'll focus on as part of that. The built environment is one. employee wellness is another, and then access to healthy food is a third. And within each of those, there's different elements. So we've spent a lot of time over the last year looking at our city's general plan, which is kind of our roadmap for development and how we envision our community over the next 20 years. And so we've recommended some healthy eating, active recreation, health policy type of things. And there's so many things that you can do as part of this. It's just picking the things that are right for your community that have the most impact and that people can easily follow, so that you're motivating them to be healthy and thrive in the community. And so that's kind of our overarching goal with healthy eating and active living.
Right. I think I've heard a statistic somewhere that Marin County is the healthiest county in the United States. Can you elaborate on that, and why then are we having this HEAL program?
Well, Marin has been ranked the healthiest county in the nation for children, I think 4 years running now. But even still, 1 in 3 kids are overweight or obese in Marin. And so it's really astounding to think we are the healthiest county, yet 1 in 3 kids are looking at long-term, lifelong health consequences of being overweight or obese. And we also know that when you drill down into certain communities, that not all neighborhoods have the same chance to be healthy. In Novato, for example, the overweight and obesity rate for kids is higher than the county average. It's more like 40% as opposed to around 1 in 3. It's more about 2 in 5 kids that are overweight and obese. There's other communities in Marin where it's more like 1 in 2 kids are overweight or obese. In Sausalito, Marin City School District, and some of the schools in the Shoreline District. And so we know that we need to focus our work in those communities to help raise the bar, and so that everybody has an equal chance for health.
And are you working with local school districts on this particular program as well?
Schools are definitely part of our partners, and Novato actually has a strong presence with Miguel Villarreal as the food service director. Our program, the Nutrition Wellness Program, does nutrition education in the schools and also in after-school programs. And, you know, the challenge with Marin is we have 19 different school districts, so there's no simple coordinated approach with the schools as opposed to, you know, a city like San Francisco. There's a much kind of easier entry point. But schools are a really valuable partner, and schools are taxed. Schools are busy and have, you know, jobs that they're doing around standards. We find in some ways much more access in after-school programming.
Which the City of Novato did an after-school initiative for youth, and we launched it last year. And we call it the BU program. It's called Building, Educating, Exercising. And we put 2 evidence-based, so proven effective programs together. One focuses on physical activity, because the goal is to try to get children 60 minutes of vigorous physical activity every day so that they can retain health and become healthy and not have overweight problems. And the other component of that program is called Positive Action, and it's all about character development and self-esteem, because we feel that those 2 married together really make it a strong health focus for the child. So there's nutrition education as part of it, there's physical education as part of it, and then there's things that help to reinforce and support having a high self-esteem. And so that's been an offshoot of entering this HEAL initiative. Another program that's related to healthy eating and active living that the city's been involved in for a number of years now is called Let's Move Cities, Towns, and Counties. And it's a national initiative that Michelle Obama started and has really kind of taken off. And it's, I think, a lot of these other initiatives around health and addressing obesity kind of spawned from that, because you really heightened awareness nationwide about the childhood obesity epidemic. And so as part of that, the city has created an ad hoc working group through our Recreation Commission that'll focus on achieving, there's 5 primary goals in Let's Move that we want to achieve, and they deal in different areas. You know, some is school-based, some is early childhood education-based, and others are just making sure that we're making people aware of My Plate, which is replace the food pyramid. So it's a way to eat more healthy, and it's a visual infographic that we can display in our city facilities. So that's just one component of what we're doing. We put out an activity brochure twice a year that we send to all Nevada residents, and most parks and recreation agencies put this out. And what we started to do once we adopted Let's Move is we used the logo, which is an apple, and we put it next to the programs within the brochure that are about physical activity, not just passive type casual activity, but the ones that are a little bit more physically strenuous, so people could really hone in on those if they want to get some physical fitness benefits. And so that's some of the things that we've been doing locally. Now, the built environment, I think, is such an opportunity for us because we've been doing such a robust program of building community recreation facilities for so long. Now it's time to go back through and look at, hey, how can we improve the active recreation opportunities within our existing parks? So take a look at doing maybe outdoor fitness courts, which are real popular right now, which give free access to fitness equipment that you would typically see in an indoor gymnasium, gym facility. And so we're looking at things like that as we're getting ready to renovate some of our major parks in Nevada.
But you were talking about incorporating many of these things in the Nevada general plan. So we have things coming down the line for us. And we've been talking about children, but what about adults?
Well, adults are facing a health crisis as well. We know that adult obesity has been on the rise over the last 20 years. We do programs for adults as well. In some ways, it's easier to capture children in their environments. It's easier to reach children. Busy working adults are sometimes harder to engage. So that requires creative partnerships. But the thing that about the built environment that Pam is talking about is that when we make improvements to the community, to the places where we live, work, and play, so that people can walk safely to the grocery store, or walk to school, or walk to work, or have parks to play in, or have access to healthy food, have a grocery store. Those improvements to the built environment, they in fact affect everybody. So it improves the health of kids, it improves the health of adults, it improves the health of seniors by changing the community environment that we live in. And Nevada is really a great example of a city kind of looking at health through that planning lens, and that health happens in the places where we live, work, and play, and that kind of leadership is something that's growing around the country, but Nevada's really been doing a great job at it for some time now.
And one of the areas that we can focus on regarding the built environment is health in all policies. So when you have, whether it be a commercial development or a residential development project come through, you look at it from a health and physical activity lens. So how does it connect to existing bike paths or sidewalks? How does it connect to the adjacent neighborhood where there might be multifamily housing or single family housing? Is it a food desert? Are there no parks nearby, even a small one? Because when you even do a retail development, you can incorporate some motivating physical activity, whether it means you're putting in bike racks, or you have a little fountain that's interactive where the kids can run and play in it, or you have seating in the shade so that others can just rest and watch after they walk all the way there or they bike ride all the way there. So it's thinking differently, I think, because everything can have health enhancement to it.
You were talking about food deserts. This is Marin, supposedly well-to-do and having access to fresh food, fresh locally grown food. But we know that that's not necessarily always the case.
Right.
And so how are we addressing that?
Yeah, well, there's particular communities in Marin where that is a real issue. We're working really closely with residents in Marin City and with the Marin City Community Services District, which is the local government entity in unincorporated Marin County and Marin City. And Marin City is a food desert. There is not a grocery store within walking distance of the community, within reasonable walking distance that a senior or a mom with kids, that doesn't have transportation could get to the store. That community only has a CVS and a dollar store to shop from. They're the only food establishments that sell food. Very little fresh fruits and vegetables. So we're working very closely with that community. We know Marin City has very, very poor health outcomes and is one of those communities with very high obesity rates. And the Community Service District has really been taking leadership like Novato. They've also adopted the Heal Cities campaign and are really, really looking at how to bring a grocery store to the community. So they are starting to work with a consultant to do a feasibility study for what kind of market would work there and how it would work and the financing, and that's a long process. Mm-hmm. It's a long journey, but the residents and the community are engaged, and there's the leadership of the local CSD. So it's really exciting. To be working with a community that's passionate and engaged like that. West Marin is also another community or series of communities in West Marin where food access is an issue. It's so geographically dispersed, and many of the markets in West Marin are very small and very high priced, and actually more tailored to tourists than to residents that need to do their full shopping. And so that is also an issue. There has been some creative solutions that I've heard about just yesterday at a meeting. The West Marin Senior Services has developed a shopping shuttle to help take seniors over the hill to be able to shop so that they can go to Safeway instead of, the tiny little market that, doesn't have enough of the full service for them. But that's also a community that, even though it's in the heart of our local agriculture, they have trouble accessing food that's affordable. Mm-hmm.
Some of the things that we're doing around healthy food access are primarily right now at Margaret Todd Senior Center, which is operated by the city. And we offer through one of our community partners, the Novato Independent Elders Program, which is operated by Episcopal Senior Communities, has a senior produce market. And so seniors can come and get smaller portions at the market. We also have a brown bag market where you can come in and fill the bag, and it's all fresh fruit and vegetables. And we're currently working with Agricultural Institute of Marin because they're doing a feasibility analysis in Novato and probably other communities in the county to do a mobile farmers market. And so we're trying to help them identify what's already happening in Novato around access to healthy food, whether there's the food bank having food distribution at some of the elementary schools like they do and other sites throughout Novato, or there's other farmers market opportunity because we support farmers markets that allow the people to use EBT or SNAP, so that what's formerly food stamps, so that they can access fresh fruits and vegetables through the farmers market. Mm-hmm. And so we're trying to facilitate a lot of that going on in Novato. And in addition, a number of years ago, the city set aside a piece of land for a community garden that's being championed by an energetic bunch of residents, and if they get the fundraising together and get it going, it should be a very nice community garden that will help with the education piece, help get families and kids engaged and educated around raising their own food and food to table to inside them. So we're excited, and we're hoping that project comes to fruition because it'll be one of our first community gardens. It's in a public park in Novato. There are some at schools, and we operate a community garden at Lew Sutton Elementary School as part of our child care program. And so the kids get to plant the seeds and grow the fruit and vegetables, and then through cooking club and other activities within the child care site, they learn all about the fruits and vegetables. There's recipes. They send things home with the parents so the parents can do some of that same cooking or preparation at home using fruits and vegetables. And so it's a great connection and educational tool having a community garden at child care site. So.
Yeah, no, it's great. I have actually been to Margaret Todd to that farmers market on, I think it's third Wednesday of the month. And when you were speaking about their being able to buy small portions, they literally could buy one radish if they wanted to. It was great because they can buy their food fresh, and there's not a lot of spoilage then if they take too much home. And sometimes those prepackaged bags of produce are too much. The mobile food truck, though, sounds very interesting. Do we have that yet in any of our communities here in Marin?
No, currently, as Pam mentioned, the Agricultural Institute of Marin is doing a feasibility study to look at a variety of communities and how that might work. One of the things that Pam brought up that is really, I think, an important thing for Marin residents to know about access to healthy food is that there is a supplemental food program. It's federally known as SNAP. In California, we call it CalFresh, and it's formerly what was called food stamps. CalFresh is very underutilized in Marin County, and so for families that are trying to make ends meet and having to make decisions between paying rent or certain bills and what kind of food they buy, the quality of the food that they're eating also decreases. And being able to buy high-calorie foods that are really cheap, is a product of not having enough to make ends meet. So CalFresh is a supplemental nutrition program that is underutilized in Marin, and it's an important thing for everyone to know and be able to help share information about the program to help improve the health of children and families.
And if someone thought they might qualify for that program, where do they go?
The Public Assistance Office is at 120 North Redwood, and you can look online. I'm sorry, I don't know the phone number off the top of my head. But the Public Assistance Office has representatives. You can apply in person, you can apply online, and you can also call.
Okay, great. So we're going to be wrapping up soon, but can you tell me what are some of your parting thoughts about these programs? Marin in general, and then Novato.
Well, I think, there is no one-size-fits-all approach to the obesity epidemic issue, and we really are needing to lean into our partners. And communities across Marin are so different and so unique and have such different needs, but part of what I think is really important is kind of looking for where the champions are in your community and then matching those champions with the needs. So we're really excited to be doing this work. There are some pieces that we're trying to kind of spread across the community that we know are really big issues, and Pam mentioned sugar-sweetened beverages, and soda consumption is really, really predictive of obesity. We recently had some county level data that came out. The tobacco control program looked at stores and their retail practices related to tobacco, but also related to alcohol and nutrition. And one of the things that we just learned, the data was just released earlier this month, is that Marin has higher than the state average in terms of soda that's sold by the cash register, and also soda sold by the cash register near schools. So when you think of young people who are walking to school or walking home from school and grabbing something to eat, or a family that's in a rush, or a working adult in a rush to grab something at a store, the soda is right there. And so that's one of the areas that we really want to be working on with our retail partners to help be good neighbors in promoting health in the retail establishments. And we know that sugar-sweetened beverages in particular are one of those really important areas.
And I think that she makes a good point about working with different stakeholder groups and the community, because there's so many little things you can do just to heighten awareness. And we want to make the healthy choice the only choice, or the easy choice at least, particularly for our youth, because if they start out being obese, they have a lifelong opportunity there to be obese for their whole life with other medical problems. The city is getting ready to convene a bunch of stakeholders to talk about, you know, what's happening out there, particularly in Novato. What are you doing? What are the gaps? What are things we should be doing that are easy, that could have a pretty big impact? Because there are some easy things that might help to have an impact, and they've found recently that in the preschool age, obesity has started to go downward. So it's lessening, but in the teenage years, it's seen an increase in the last year. And so a lot of that can be attributed to the sugar-sweetened beverage, but it's also 7.5 hours a day of screen time where they're either on their cell phone or a computer in front of the television. And there's nature deficit disorder where they're not getting outside and they're not engaged out there and exploring their world and, you know, roaming around the hills and the rocks and just getting out there and being active. And so it's much different than the way we were 30 years ago. They're indoors more, they're not outside as much, they're just not as active, they're not prone to being that way. And so that's part of what we hope to achieve through these efforts, is to get the community active and interested and really thriving, because they're healthy, they're out in the community, they're engaged, they're connected, and there's so many opportunities for them to be healthy and access healthy food and active living. And that's the bottom line of what we're trying to achieve.
Well, thank you guys. Thank you very much for participating tonight.
Thank you.
Thank you.